No problem.
Next, we have just a reminder, if at any point you are leaving before the end, please fill out the survey. I left the link in the chat. So please, 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 please do that. We really need that. We're next going to go on to Shihan, who's going to do a presentation on dentistry and how to get in. And then we'll have Luazi, who's going to just talk about her dentistry experience. So Shihan, I'm going to give you the floor now.
Okay, let me just get out. Can you all see the screen?
Yep.
Okay. I'll just put it from the start. Hi everyone, so I'm here just to talk about dentistry. My name is Shihan Bandy Brown. I'm from the University of Manchester. I'm in 3rd year and I'm going into my 4th year now. So yeah, that's a little bit about me. So why dentistry? I chose dentistry because it's very hands-on, especially if you go to a uni that starts very early. You get to work on the cadavers, work with your hands, especially compared to medicine, I feel like. You're constantly learning, kind of the same idea as medicine, you know, constantly changing, constantly improving treatment for patients and research and all that type of stuff. Specialties, as opposed to medicine and dentistry, you don't actually have to decide on a specialty. You can just go into general dentistry. And along with that, let's say if you have an interest in a different side of dentistry, let's say orthodontics or like oral surgery, you can do other courses that can like give you more information around that, which wouldn't necessarily be like a master's but to become like a specialist, but it would give you those skills so you can do more work around that like specific specialty you want without the commitment of like a master's and the whole process of applying and all of that type of stuff. And usually actually as a dentist, you may be actually the first person to diagnose a health problem or to like detect a health problem in their early stages, such as like even hypertension, diabetes, or, you know, the more obvious like oral cancer. You get to build a strong relationship with your patients, even from dental school. Even I've like built a strong relationship with some of my patients I have now, especially since you're going to be like regularly treating them, especially the type of patients you get in dental hospital. They need several types of treatments and fillings and all of that type of stuff. And that's actually one thing I saw in work experience that actually really attracted me to dentistry. A great work-life balance. Yeah, you don't, you know, that night shift stuff isn't really our portion. You know, we don't have to do any of that. Sorry, medics. But yeah, you do get to do like emergency work on Saturday and stuff like that. Obviously, you get supplemented with like a better pay, more experience and such. And I'd say if you're still stuck on both pathways, the best option is to try and get into a variety of work experience in both dentistry and medicine. I kind of wish I did that more as well. So I looked into medicine and dentistry, and that would have been, and it's also a good talking point to show them that you're dedicated, that you've had a look at other stuff. You haven't just been like tunnel vision. But yeah, so what qualities do you guys like think make a good dentist? Would you be able to maybe like put that in the box, in the chat box for me?
Can you see the chat?
I'm going to try and get it up. Yeah, I can see it now. Oh. Someone said, can they screenshot? Would they be able to get the slides? Could I send it to you?
Yeah,
and you can send it
no
to
worries.
everyone?
We will be sending out the slides to everyone who's attended. So if you want any of the slides, just send us an email. We'll just send you the whole presentation, so you don't have to screenshot anything.
Yep, work well in a team, professional, good at interacting and reassuring. Yep, especially when people are afraid. Yep, those are some good ideas. Steady hands, yep, that does come into play as well. We'll talk more about that later as well. Good attention to detail. Yep, you are literally working with like millimeters to make such a difference to teeth. Yep, willingness to read on new discoveries in industry. Yep. Team worker. Yep. Yeah, you guys have got some really good answers. I think it's pretty much covered everything I was saying. So good communication skills, that's basically the basis. That comes underneath like being able to reassure people, being able to explain like difficult concepts to them in like layman terms. Because once you start talking in jargon, you know, most people don't really like the dentist, let's be honest. You're speaking jargon to them. They're just going to feel more uncomfortable. So you have to have that skill. Manual dexterity, that's the thing with like steady hands. It's just basically being able to use your hands efficiently. We'll talk more about that. You'll be surprised how it kind of just falls into your everyday life as well. Desire to acquire scientific knowledge, especially in anatomy and oral disease. Yep, so basically interest in science and new discoveries. Detail orientated, yep, you're working with millimeters. Problem solving skills, yep, you'd have to be able to figure out what's wrong with the patient, what treatment would be best for them, and not just their mouth, like their whole life, their health. And patience, yep, sometimes patients, you have to be quite patient with your patients because sometimes they just don't understand. Sometimes they don't even come because, yeah, that's just a part of it though. And compassion and empathy, and that's understanding where they're coming from, understanding that the social and economic background that may affect their oral hygiene or just their general health or even their ability just to come into the clinic to see you. So what to consider when choosing, like when you choose a dental school. We've kind of already gone through this as well with medical school. It's the same idea, you know, you need to, you know, make sure that you decide whether you want to stay in like a city or campus, where the location is, the size of the medical or dental school cohort, you know, that can also like affect maybe the amount of societies they have as well. Location and distance, you know, time to travel from home to where you are. I feel like I considered it, but I didn't really think about it as much, about how much you'd be able to go home, the prices, and all of that type of stuff. Patient contact, how early do you get to be in contact with a patient? That's one of the reasons why I wanted to come to Manchester actually, because it was quite early on. We started seeing patients just in second year, and we started seeing each other, like other dental students, and just doing like basic history and exams around the end of first year. And I liked that idea of like prepping me towards that, as opposed to other schools kind of doing 3 years of traditional like scientific work, and then you see your patients in the last 2 years. Use of cadavers, whether you feel like that would help you or not. And how the course is taught, obviously, like there's different styles of teaching, such as traditional, PBL, EBL, and then you have integrated. I go to Manchester, which is PBL/EBL, and I just felt like applying that to a real situation would just help me learn more. But you do have to, I think Anna said it before as well, she was like, you do have to read around stuff yourself more, and it's not as much as like spoon-fed to say. So now we go into the grade requirements. The grade requirements are usually quite similar to medicine, but it does vary from between different dental schools. So I'd say always check in like whatever school you're interested in, go on their specific website and read the whole page, just to make sure. You just don't want to end up in that situation where you've applied and then you've realized you don't have it, and you have a great application, but you just don't have exactly what they're looking for. So in A levels, you need 3 A's in A level or above. That's most dental schools, including biology and chemistry. Some may say biology without chemistry or chemistry without biology, but I'd just say biology and chemistry just to, you know, increase your chances. And beware of maths and further maths. A lot of schools won't consider it as like 2 separate subjects, so just be aware of that. And in GCSE, there's a lot more variation. I think Anna said this in her slides as well, I got to that conclusion as well with dental school as well, and I was looking at everything. About 7 GCSEs, A or like 7 or above. And I'd say if you're getting those A's, make sure to include them in your core subjects like English, maths, and science, because I actually know a few people, like they would try to apply to school and let's say they've got A's and stuff, like even compared to me, they've probably even got more A's, but because they don't have an A in English and I had one, it was like I could apply, they couldn't, or like I had an A in maths and they didn't. It would just make it difficult for them. I've also got more information just on this website I just found. They're the 2019 requirements, but they're a good guide. You could take a picture or snapshot if you want to. I'll just leave that there for a few seconds before I go on to the next slide. Okay, I think that's okay. And then UCAT and BMAT, or also known as UK CAT before. So I'll go through the UCAT first. So the sorry, I might be saying UK CAT, it's just UCAT, but UCAT is a 2-hour multiple choice test. We've talked about it before as well. It's the same thing that was talked about earlier where, sorry, my screen. Okay, where it's just to test your mental abilities basically, and just to, you know, just another barrier, I guess, just to kind of like filter out students. The results are available immediately. Yeah, we talked about that before. You can use it for your application. And I've got a website here that's the link that you could take a picture of as well. It's the medicportal.com/application guide UK CAT and all of that, just for you to have a look and see what different schools want. And then we've got the BMAT 2-hour pen and paper test, the 3 sections, aptitude and skills, scientific and written. Only one dental school does it, and that's the University of Leeds Dental School. And I'm not gonna lie, I just saw one dental school and I was like, it's not even in London, it's not really in a city, it's okay. But I mean, it is a really nice uni. I think I know one girl who goes there. So, you know, if you like it and you visit it, then I would say go for it. And you can only take the BMAT once this year, obviously because of the COVID thing. And I think the University of Leeds only accept it when you do it once. And then this is just about the website I was talking about. So this is like just a screenshot from the website, kind of how it works. So it's got like a list of the universities, and then it's got the code for the universities. I don't have a clicker, but if you go to the bottom box here, it says dentistry courses start with A2. That's just a general like thing that helps you look for the course. So let's say University of Glasgow here, A2, and that's how they would use it for their medicine and dentistry. So medicine's A1, dentistry's A2, and there's just the link there if you just want to take a quick picture or snapshot. And then these are just the key dates for UCAT. I mean, you can take a quick picture. I think it was in the other slideshow before. This is just for 2020 for those who are thinking of applying, who are going to year 13, but there's quite a lot of year 11s and 12s in this chat, so I'll just go through it quickly. And that's BMAT if you want to take a quick picture or snapshot. And then work experience. So with dentistry, I would recommend a minimum of 2 weeks. It's just required for most dental schools. Some of them aren't as, you know, tight up about their understanding. And obviously with the pandemic, it's a bit different. So they would be more understanding. And as they were talking about before in the other lectures, I mean, in the other talks, they were talking about other ways you can replace it with like virtual work experience and stuff like that. The same thing applies to dentistry. There's actually another source I was going to say that would help, that I'll mention at the end. So NHS general dental practice work experience is like pretty much essential, because when you graduate, you know, you work a year in a general practice as a foundation dentist, and then it would be very beneficial to have a variety of work experiences, but don't make it like what others were saying before. Don't just make it into like a checklist, like I did this, and then you have no reflection. The reason why the variety of work experience would help is that you can compare and contrast between your different work experiences, and how you can appreciate that a dentist isn't just like that one job they do. Like, it's not just that specific, just GDP, and that's the main thing. There are other like streams of dentistry you can go into, and there are other team members in the like dental profession that dentists have to work with. As you guys said, like, good team working skills. So you have to work with your technician, your hygienist, and I'd say with hygienists as well, they're usually in a dental practice as well. So they usually may have a day in or something and just say, can I have a look at them and see what they do? And the tip I would say is keep a diary or notepad during your work experience. Just make that like a little book, just to write down anything that you saw interesting, anything that you liked, or anything you think you can talk about in your work experience, because I feel like that saved me so much. Like, I thought I remembered what was going on, but then I read the book and I realized, oh yeah, like I can go in much more detail. Anyway, so how do you get work experience? These are a few of the ways I did it. It's already been talked about as well, so I'll be very brief. It's the same idea for dentistry as well. You contact your general dental practice, you ask about work experience, be willing to travel a bit as well. You may have to travel, it may not be in your local area, but just due to how, some dental practices, they're just so busy. And there may be certain times of the year where they may not be busy and they may not mind. And there may be certain times of the year where they're busy. So make sure to ask them that as well. I actually walked into dental practices and asked in person. Obviously, this was before COVID, that is not a good idea though. I mean, hopefully once everything clears up, maybe you could just be cautious about that as well. Ask your own dentist for help as well, even if you're not that close with them. I feel like dentistry is such a small, like, it's kind of nichey. Like, medicine's already kind of like set past, and then dentistry is just like way more niche. So they would usually be, quite accepting to help you out. Also, like, try and offer services to them, such as like just admin work for experience. Like, I did like really basic, just helping them organize stuff. Like, it was really petty work, but like just, whatever can help just run their surgery, like even just making them tea or something, because they'll give you the chance to have a look at the patients working, which is very valuable experience for you to understand. So I'd say do that as well. Search online for programs, especially in hospital. I know guys in St. Thomas do one. I don't know if they still do one, because I'm going into my 4th year now, so I don't know if it's still a thing. Also speak to your school, see if they have any connections. Also, if you have Instagram, maybe even try and approach dentists through social media. They may ignore you, but if you write maybe even a paragraph just explaining your situation, there might be someone that might reply. I haven't tried this, but someone came up with an idea which was really good. And as I said before, it'd be nice just to write like just even like a short page, like a 1-page, like really short and concise CV, or just a paragraph just explaining what's going on. And if you really can't, just volunteer in a healthcare setting, such as like a nursing home or like other places like that, where you can link it to dentistry, because dentistry is just about, also like, obviously it's about the mouth, but it's also about treating the patient and seeing them as a whole person. And I think that's another thing that would really stand out, if you have that understanding that it's not just the teeth and then that's it. And then, so manual dexterity, this is like the steady hands, making sure your hands are good. I'd say manual dexterity is just a skill that requires you to use your hands just to carry out a task. It's funny because some dental schools, they will look at it and they will ask you in like an interview to kind of do something like but like even the manual dexterity they test you on isn't as like intricate as you think it would be. You don't need like an A in GCSE or R or anything crazy like that. Some don't even ask about it. But there are several ways you can showcase your manual dexterity, and it might even be in hobbies you already like do, such as like drawing, sketching, instruments, model making, pottery, carving, henna, cake decorating, even calligraphy. Even if you like to like sew your own clothes or something, or if you get experience in a dental laboratory, anything you make there, if you are able to. And those are just some of the examples. And yeah, as I was saying before, you may be asked directly, or some dental schools may just not ask at all. I remember reading Manchester, they were like, okay, it is good to have manual dexterity, but obviously you will learn it and you will develop that skill in dental school. And it's true, because you're going to be using your hands anyway so much. Yeah, just a few personal statement tips. I know we had a whole slide thing about it. You can apply whatever was in like the last talks for dentistry, because it's the same idea. Make it genuine. Just don't be dramatic and say you wanted to be a dentist since you were 5, because like, let's be real, that's not a thing. I mean, it could be, but yeah, just phrase it a bit better than that. But list achievements and order them from most to least important before you start writing, so you can have an idea of what you really want to put in there. Kind of list the qualities of the dentist, which is why I listed that's why I said like to everyone, what do you think the qualities are? Because that would help just you to base your personal statement around those qualities, because that's what they would want, because at the end of the day, after dentistry, you'll be a dentist. So yeah, so say to others why you want to study dentistry and be a dentist, because once you say it out loud, you can kind of it kind of just puts into perspective what you want to say on paper. It just makes it a bit easier. And use your work experience diary. Be reflective, as they said before. Don't just list stuff. Say what you've learned and say what you've genuinely like taken away from that work experience, not just list them. Read books related to the course. Include something that showcases manual dexterity. It doesn't have to be very long. It could just be even one of your hobbies, which falls into extracurriculars as well. So, you know, you could kill 2 birds with 1 stone in that sense. And then you've got interviews. So there are 2 types of interviews for dental school. You've got MMI and panel interviews. Actually, before, I think when I was applying, there was much more panel, but now they're starting to become more MMI. Like when I did Manchester, it was panel. I think I only had 1 MMI, which was Bristol. And then those are the ones. So you've got Birmingham, Bristol, Cardiff, King's College, London, Leeds, Liverpool, and Manchester now has changed to MMI. And then panel, Belfast, Dundee, Glasgow, Berks and London, and Newcastle, Plymouth, and Sheffield. You could just take a quick picture or screenshot of that if you would like. And these are all the dental schools I'd say are, sorry, I based this more around undergrads. There are, I think, 2 to 3 more postgrad schools. I think there's UCLan, and I'm not sure about Aberdeen. I'm not sure if they just do medicine. But yeah, and then these are just my top tips just to leave you with. Make sure you read the dental school specific like requirements, like for that dental school, like go on their website, read it. Be strategic with your choices, as other people were saying. Obviously, you may have a dream dental school, but also make sure you put down schools that you know you can see yourself at, but you know you've got what they want. Different dental schools find different things important, as I was just saying with the be strategic, and have different like methods of picking out their students. Research and get a good understanding of dentistry, what it involves. It will show in your personal statement and in your interview. Try and get a variety of work experience. If you can't, just make the most of what you've got. Try to get work experience in medical and dental field if you're finding it hard to choose, and just be generally authentic in your personal statement. And so resources I would recommend, one resource I'd recommend is a Future Learn course. There are like courses online that you can do, from random stuff from photography to everything. And there's one that's Discover Dentistry. I did it actually in my personal statement, and I found it did help. It was quite interesting, and it was a bit, I guess it was a bit different for them, and it just showed that I was willing to learn more about it. Here are a few of the books as well. Getting into dental school by Adam Cross, dental school interview, getting into medical school 1,250 UK CAT practice questions. UK CAT is the same as UCAT.
Yeah, so
I
I was
think
gonna say that's the book that I was talking about earlier that I used. But when I did it, I think it was 900 questions or something. But
yeah,
that's a really
I think
good
when
book
I did
for
it, it was
practice.
1,000. So it's been
Yeah.
changing over the year. Like,
Yeah.
it's actually, I feel like that is like such a good book. You guys like really use it. And a website, Medic Portal. I get it says medic in it, but it also talks a lot about stuff with dentistry and even just comparing it. And I've also just left my email there as well. So if you could just take a screenshot if you want to contact or you have any more questions, yeah, I'm open to. And yeah, that's me for now. Yeah.
Thank you very much, Shihan. That was really, really good. Good insight into dentistry. I feel like that was something I wish I did look into a bit more before I decided medicine was for me. So yeah, really good to think about dentistry as well as medicine if you're at the stage where you're deciding which one you want to do. Because there are a lot of perks to being a dentist in comparison to a medic. There's no night.
You get a free
Way
electric toothbrush, yeah. In
free.
dental school we get like quite a few free stuff, yeah.
So yeah, definitely something to consider.
Could I answer this question quickly, because I'm not sure if I'll be able to stay for the whole thing?
Sure.
I've heard that dentists end up paying back loads of money for their student loan, if that's true. I haven't heard of that, because we all pay the same 9,250, unless if you're like an international student, then it's literally they pay like crazy sums. But between them and medicine is like maybe a few thousands more. If you put into context how much they pay, it's not that much different. But I think maybe it's America, maybe that might be a thing, but I haven't heard of that in the UK, no. But yeah, thank you for having me.
Thank you very much. No, thank you for being here. Luazi, I think you are next. I'm going to make you host so that you can share your presentation. Sorry guys, we're running a bit over time, so for the next few presentations, if you can just make it as succinct as possible, just so we have enough time to do Q&A, so everyone can ask any questions they have. But yeah, thanks.
Hello, I'm going to just try and see if I can get it up on my screen.
Perfect, thank you.
Okay, so hello everyone, my name is Luazi, and I'm just basically going to be sharing a bit about my experience as a dentist. And before I start, if you like, I'm not too sure if I missed it, but if anyone who's interested in dentistry could comment and just say, oh, I'm interested, or if anyone's debating between medicine and dentistry or considering it, that would be good to know. So, and if you've got any questions, feel free to pop them down as well. And I'll try and be as quick as possible. Okay, so first of all, I'm just going to talk a bit about myself and then why I chose dentistry really briefly, a bit about my job history so far, what dental school is like, and some top tips for you to succeed when you do get into dental school, because the hope is after this presentation, you will get in and then you have a bit of a heads up before that happens. And then a little bit about what it's like afterwards. And then I'm going to just do a short bit of information about getting into dentistry. Shihan's covered a lot, but I will just say any things that maybe I can add, and then a couple of career ideas afterwards. Okay, so a bit about me. It's kind of hard to see as I've got the thingy scrolling. Can't see the top of it. Okay, so a bit about me. I'm from London, from Islington, originally from Zimbabwe. I don't come from a family of medics and dentists, so I am the first. I got into dental school at 18, and these are the dental schools I applied to: Birmingham, Bristol, King's, QMUL, and I graduated from Barts in 2017, so 3 years ago, and these are some of my grades and some of my GCSEs. Just a bit of background in terms of me getting into Barts, just so that you do know, I actually got rejected from Birmingham, Bristol and King's College, and Barts is the only university that I actually got an interview for, and I was a bit like, whoa, how come this has happened? But I just wanted to let you know that if you are in that position where you do get rejections from universities, whether it is you're applying for medicine or you're applying for dentistry, it does happen, and you can get to where you want to be. And that obviously for everyone, the chances are about 1 in 10. So it isn't the greatest of chances, but it's just best for you to just do your best. Okay, so in terms of why dentistry, this is a big question, and it is something that you're going to need to think about when it comes to doing your personal statement. But I can't remember the name of the great person who spoke a little bit before, Sheehan, when she talked a bit about personal statement and knowing your why. This is just something for you to consider, and it's also really important because it's all really well and good to get into dentistry or medicine, but when you're in dental school, or when you do become a dentist, or when you do become a doctor, you need to go back to your why you're doing what you do. So that will help you to succeed continually. In terms of why I decided to do dentistry, the idea came after I had braces. So I spent a lot of time being in the dentist, and then I kind of thought to myself, this seems like it could be a great career. And then that was when I was about 12. And then later down the line, I had a bit of work experience with a dentist, and that sort of inspired me to continue going down that route of dentistry, and then I just basically decided to go for it. And so that's a bit about why I decided to do dentistry. Obviously, in terms of looking at the specifics, that is going to be different for each individual, but I think for me it was obviously that people aspect, and generally the advice that you're sort of given to talk about why dentistry is thinking about the connection that you have with people and science, and obviously with using your hands. Those are the 3 sort of things that you want to be thinking about. And if those things do suit you well, it's definitely something for you to consider, even if you're thinking about medicine. Okay, and I can't see the questions if any of you guys have asked questions, so I will have a little look later. But in terms of what I've done, in terms of what Sheehan sort of mentioned, after I graduated, I did my foundation dentist job. So that's basically a year after graduation where you spend in an NHS practice and you're a foundation dentist. And so you are independent, but you have an educational supervisor who sort of helps to mentor you along. And although maybe you're thinking, okay, I want to do dentistry, what is the relevance of this presentation? I think it's really important to know what is going to happen after dental school. And if you do manage to get an interview, at least it gives you the awareness to know what life is going to be like as a dentist, and for you to know what to expect afterwards. So I did my foundation dental training in Exeter, and then afterwards I did a bit of dental core training. So that's essentially when, after you do your foundation dental year to work in an NHS practice, you've got the option to continue working in dental practice, whether it be private or whether it be NHS, or you've got the option to go along the dental core training route. And so that is essentially when you're usually tied along to the community dentist dental services or hospital dental services, and you're still having training. So you still see patients, but you have to maintain a portfolio and hit certain different targets as well. So I did that. So that was 6 months for oral maxillofacial surgery and 6 months for community dental service. And again, if you're thinking about doing dentistry and you're seeing these words like OMFS or CDS, and you're not too sure what they mean, it will be really good for you to have a look at what these parts of dentistry are, for you to sort of consider that. And that will definitely shine well when you are having your interview, so you can talk about that. And then in terms of what I'm doing right now, that's basically, I am in my 2nd year of dental core training, where I've had a pediatric dental post in Birmingham. However, due to the pandemic, that's not currently what I'm doing. I'm actually doing district nursing, which is a bit different, but that's just basically due to COVID. So I've been able to apply my dental schools in a different way. And in terms of what I'm going to be doing afterwards, I'm going to be doing a leadership fellowship post, and that box basically explains what that's going to be like. So it's good for you to know that after dental school, when you become a dentist, there are different options, and it's really good for you to be aware of that. Or it's good for you to be thinking maybe in 5 years' time, when you're finishing dental school, and you're thinking about what to do next, at least you'll have a couple of ideas to think about what you can do after that. And the other key thing to mention is that I've worked in quite different places. So Exeter, Worcester and Birmingham. And then this job is actually in Northampton, so it's a bit different. And so the key thing is that if you want to do different hospital posts, you might have to be flexible to move to different places. Okay, so in terms of dental school, this is just basically my experience, and it's really important to know that each dental school is different, but I think the main themes for you to understand is that obviously there are 5 years. There is the option to intercalate and to do like a integrated BSc for some universities. It's not really something that everyone does for dentistry, but it's good for you to be aware of it if that's something that you do want to consider. But the main aspect for you to know is that dentistry is so hands-on. You are going to have your own patients. You are going to be your own dentist, dental receptionist. You're also going to be dental nurse. So there's lots of different things for you to handle. But firstly, there's going to be, you're mostly spending time with learning about theory and being introduced to actual dental clinics. And then afterwards it moves on to working on phantom heads, which are basically like dummy heads with fake teeth. And you're practicing drilling holes and doing things like that. And then you start to see some patients. In my dental school, we just sort of started doing new patient exams, and some people got to do cleaning. And then as you progress, you get more and more clinical exposure and a bit of reduction in theory, and then it's more applied. And then finally, yeah, you're mainly on clinics, some theory, but not as much. And that's pretty much that, my experience. And again, when it comes to applying to different dental schools, the main important thing for me that I want to stress is looking at different prospectuses. I know for medicine, it's quite important in terms of like, it's not just about the name of the university, but it's about thinking about how you learn. So I think, for example, Manchester uses a lot of PBL. Shehan might be able to, I think she goes to Manchester, I think she might be able to talk about that, but that's not something that we use as much in Bart. So if you're someone who learns in a certain type of way, you want to be looking at that for your dental school, or also for your medical school experience as well, to make sure that you have the best time. Okay, so really quickly, top tips for dental school. Main thing I would just say when you get in, or even this is applicable to everyone, is just basically have lots of fun. I had lots of fun when I was there, and getting involved in societies. These are a bit like clubs, and you get to do things. And so the key thing is you want to basically shine. And when you're doing things, and when you're having fun, being involved in societies, maybe having positions of responsibility, also adds to your CV. So when you finish dental school, regardless of it, whether you want to work in practice, if you're a dentist, or if you're a medic, whether or not you're, I guess it's a set route, it's still something for you to add to your CV. Just in the same way as you guys are prospective students, we're encouraging to get involved in volunteering and have a social life and things that you can show for. It's the same thing for university, because it's going to show those skills of being a leader and being able to work in a team. And the other thing that I want you guys to be aware of is also being aware of organizations, for example, Rare Recruitment and Powerful Media. I can't remember how I heard about these organizations, but I heard either it was in the beginning of first year or end of sixth form, end of year 13. And you can Google these organizations, but they basically hold different events for Black students who are mainly going to like Russell Group universities. And it's just a really good way for you to mingle and get to know other students who are doing a similar thing. And so it's, yeah, and also they have different awards. So Powerful Media publish a Future Leaders publication every year, and they list like the top 100 Black students in there, and you can always nominate yourself for that, and it's something that is going to be amazing for your CV later down in life, so you can do that. The other thing is like electives. So different universities have the option to get involved, for you to get involved in dental electives. So I went to Sweden as part of mine, and that was just really good experience. And again, it's something to have in your CV. The other thing to get involved in, which I didn't really get involved in, but I would recommend from hindsight, is to think about, and this also just applies for if you're wanting to do medicine as well, thinking about if there's any publications you can get involved in. By publications, I mean like written papers for like peer-reviewed journals. So like, for example, the British Medical Journal, the British Dental Journal, like thinking about ways that you can link in with different academics or different students who are keen on that, because it will really help you, especially if you are a medic as well. I know it's really competitive to get the different specialty posts that you want, and so if you've got these things from when you're a dental student, which sometimes can be really easy, it'll just set you up for a bit in the future. The other thing to think about is mentorship as well. When you're in university, obviously being the best version of yourself, which you should do for any course, any job, but if there are any sort of dental lecturers or people that inspire you, or you think that you maybe can build a relationship with, it's really good to have that, because afterwards when you finish university, you never know what that might bring, or you never know what that relationship what can happen as a result of that, in terms of support and in terms of provision for mentorship. The other thing is getting involved in awards, prizes and competitions. So thinking about what else is there. So for example, I've just listed 2 dental organizations, and there's so many different specialties or organizations, and the same thing for medicine as well, but they always usually have student competitions and essay writing, things like that, and not many people actually enter them. But if you get it, that would be amazing. Another thing to boost your CV. Finally, just a bit of advice is be careful with your finances, because you can end up saving and buying a house, which is something for you to think about when you're a student. Okay, so I'm going to skip this one, but just basically after you graduate, you can have fun. It's up to you. You can do what you want to do. Okay, so the main important part is getting into dentistry. So I'm sure this is basically applicable. Everything is applicable to medicine, really, apart from this one aspect, which is fine motor skills. I don't know if you can see me highlighting that, but volunteering, I'm sure it's been stressed, is super important. I think obviously with COVID, it may be difficult, but in this day and age, no one's really going to say no to free support. In terms of work experience, just to say, I understand it can be really hard to get it. I sent like 100 emails and it was really difficult. The only way I was able to get some dental work experience was actually thankfully through my secondary school, and then also through a friend of mine managed to ask her dentist to give me work experience, and that's how I got it. And so a lot of the time, just as Shehan said, it's through your contacts and networking. Ask people, ask around, obviously contact the African Caribbean Medical Association mentors and see what they have, and just be really keen and proactive, and you'll get something in the end. The other thing is extracurricular activities. Just want to add, the dental schools, and I'm sure it's the same for the medical schools, they want to be able to see significant achievement. So what that means is everyone's going to have, I volunteered in a care home, or I've helped volunteer in like daycare or something. Everyone's going to have that, but thinking about whether or not there's any provision for you to actually make a difference. So for example, instead of just saying, oh, I volunteered at the at a care home, you can say, oh, I volunteered at a care home, and whilst I was there, I was able to maybe set up a dance class for the elderly. I was able to actually do a bit of, I don't know, spoken word for the youth that I helped to volunteer with, or I helped to lead this, or I helped to lead that. And all of that is also showing your leadership skills. And also a bit of advice for when you do this is asking whether or not you can get a certificate, because that certificate can be something that you can add to your CV, and it will just boost what you've said. It just sort of acts as proof, because anyone can say they volunteered and it may not even be true. So you want to definitely get that. The main key thing for anyone who's a prospective dental student is fine motor skills. And so obviously that's the main difference in terms of the actual being in the dental school, where sort of obviously medics are seeing patients, but we're having our own set of patients, and we are very, manual dexterity is so important. And so you want to think about whether or not you have this, and if you don't have this, you want to think about whether or not dentistry is the right thing for you. In terms of these fine motor skills, I think it is quite hard to be able to know whether or not you have it if you haven't done dentistry. It's totally different. But thinking about ways to improve it might be getting involved in like doing sewing, doing knitting, if you have the opportunity to play an instrument, if you have the opportunity to cake decorate. Obviously that's amazing for your personal statement, or it's amazing for your CV, but it can also just help figure out whether or not it's not right for you, because at the end of the day, if you can't do it, you need to make that decision for yourself and think about whether or not medicine might be a better option or something else. And it's better to realize that before you enter dental school than suffer whilst you're in dental school, because it definitely does happen to some people. The other thing is question banks, specifically asking people who have gone through the interview process what questions that they have. Obviously there's no guarantee that these questions may happen, but you can only go so far with what you know and other people's experiences, as much as books and things like that. But like collating this information, like contacting maybe people in your school who have got into medicine or dentistry and asking them for information and advice for that. Yeah, and the other thing to note is most dental schools are doing these MMI stations, that kind of thing, and you may even actually get asked to do something that is going to use your fine motor skills, and obviously practice makes you better learner. So practicing the questions with other people around you who are dental, who are non-dental, who are medical and non-medical, just getting used to the pressure and seeing what that's like. And then, as I mentioned earlier, is the individual prospectuses, seeing what the certain dental schools want. So linking back into work experience, like I think, for example, some dental schools will specify that they want 2 weeks. In terms of work experience, also linking them with, like, for example, I think Barts have, I think they do have a scheme potentially for people that live in East London to get involved in different work placements. I think that's medical as well as dental as well. So that's something to consider. Finally, just think, this is also important for interview, is just so that you are aware of the bigger picture. In terms of dentistry, most people think about being a GDP, working as a high dentist, but there are so many different options. There are 13 specialist lists. And this is important for you to think about, obviously, when you're in dental school, but when you're going for the interview, to have an awareness of this is actually really important. So these are a couple of different options for you to consider when you finish dental school, and also for you to be aware of for the interview. So that's just a couple of things. It's not an exhaustive list, but that's something for you to think about. And just thank you for listening. And I'm not going to be able to say for the Q&As, but I'm just going to check now to see if there are any questions. Are there any questions? I can't see the.
And there's just one question about how you can get a publication as a student. As
a dental student, or is that as a year 13? I'm assuming it's like a 13. In terms of,
yeah, I'm assuming
now,
as
clarify.
Like, Anastasia, if you can clarify.
Yeah, in terms of right now, by the way, this is something that is difficult even as a qualified dentist. This isn't something that's easy, so just want to stress that. But in terms of as a year 12 or year 13 student, that's not something that would be expected of you. In terms of being if you are a student in dental school, Anastasia, or in medical school, it would be for you to ask the lecturers and things, and to come with an idea maybe and say, oh, I may be interested in doing this. What do you think about this? Or looking at the work that they're doing potentially. So yeah, it's not really for something that if you're in year 12 or year 13 for you to be doing. If you could potentially, but it's usually that you need to be tied in with like an academic institution most of the time. But maybe things that you could do as a year 12, year 13 student is like maybe write an article for like your local newspaper or for your school, like potentially linking in with dentistry, or even not linking with dentistry. That's something that you can consider doing. Oh, and we've got a couple of people that are interested in dentistry. That's really, really good. I think if you are interested in dentistry or medicine, just think about it. Main differences maybe will obviously be the lifestyle. If you are a doctor, you're going to be having on calls. You can obviously have on calls as a dentist. I spent time doing hospital jobs, as mentioned before, and it is a bit tricky. It is a bit different in terms of being a dentist. Obviously, there's a business element that links into it quite a bit more, especially if you're in general practice. The main difference is kind of also working with your hands. Whereas if you're a medic, you're not really doing it as much. Obviously, if you are a surgeon, you are definitely working with your hands. But if you are debating with the two, try and see if you can get work experience in both and just go along with that.
Thank you very much, Lazi. That was really useful, really helpful. A different take on dentistry and a bit of more information on it, dentistry as like a career and the different aspects of that. So thank you for that. We're going to move swiftly on to the graduate medicine with Teresa, and just try and be as quick as possible. I know that it's running over, but I think everyone's been enjoying it so far. Let me just, okay.
I'll just share my screen now.
Thank you.
Okay, so hello everyone, my name is Teresa. I just wanted to find out who is actually applying to graduate entry medicine. Are there people who are in the process of doing that? If they could comment below. Okay, so it seems like not that many. I don't think I'll be able to stay for the Q&A. So if you do have questions, you can just pop them here if they're like not covered in my presentation. So let me start. So as I said, I'm Teresa. I'm actually going into my 3rd year of medicine at Bristol. So for graduate entry medicine, there are a few options. So you can either apply to the graduate medical degree, which is 4 years. You can apply to the undergraduate medical degree, and that's 5 to 6 years, depending on whether you intercalate or not. Do note that some universities, intercalation is mandatory, even if you already have a degree. So it's important to be aware that if you definitely don't want to do 6 years, then don't apply to those universities. And I've only done a bit of research, but I know it's going to be covered later on studying abroad. There are some other countries that you can go to that do graduate entry medicine as well, which is 4 years. So these are a list of the universities that do the 4-year graduate entry program. Compared to, so I applied, I started my application in 2017 and I started in 2018. So a lot of this stuff is kind of always changing and different. So do keep an eye on like websites and keep an eye on the university's websites to see, because I know some universities did graduate entry medicine and they stopped it, or they, you know, started doing it, but do kind of make sure that you're keeping up to date with stuff. So yeah, these are the ones that do the 4 years. And then when you compare it to the universities that do the 5 to 6 years, you can see that there's, you know, a lot more. So that's just something to keep in mind when you're applying. A lot of the universities that do a graduate and entry, like an undergraduate medicine, if you have a degree, you do have to apply for the graduate entry. So just be aware of that. Oh, sorry, I don't know why. So things to look out for when you're applying for graduate entry medicine. I think one of the main things is to really look closely at the university and look at what their requirements are. I think sometimes with graduate entry medicine, people assume it's kind of a thing of like, say you didn't get into medicine when you applied before, that the requirements are very different, and that sometimes isn't the case. Sometimes they will expect you to have the same requirements for medicine if you were applying from sixth form, but on top of that have your degree. So you want to look at what class of degree that they asked for and make sure that you're aware of that. Look at what requirements they want for A levels, GCSEs, because some universities will specify that even if you're applying as a graduate. And as I said, there's no point wasting a choice if you're just not going to have the things needed to apply. As I mentioned before, some of the courses, they won't allow you to apply to undergraduate if you have a degree before. So keep an eye out on that, especially when it comes to admission tests, because you may think, actually, I only want to do the UK CAT. Some undergraduate courses at the same university will ask for the UK CAT, but for graduate, they'll ask for the GramSat, so be aware of that. And some universities, they have a specific requirement of the degree that they expected you to do before, in order to apply for graduate entry medicine. So for example, when I was applying, Imperial had a list of degrees that they want you to do before you want you to do in order to allow you to apply to the graduate entry program. And if they weren't sure if your degree fell into that, then you had to send a form to your previous university for them to confirm that you've covered like X, Y, and Z. So that's important, because if you feel that your course has the qualifications but the university isn't deeming it so, then you just won't be able to apply for the graduate entry program at that university. So requirements for UK universities. So for graduate entry in the UK, you can do UK CAT or GramSat. I believe like it's UCAT now, but those are the only two that you can do. You can't do BMAT if you're applying as a graduate, because they only accept BMAT for first degrees. And then as normal, you'll do a personal statement and then you'll do an interview. So that's just like a diagram that I made. So for UK CAT, these are the universities that take UK CAT, and that's a mixture of the undergraduate and the postgrad. And then these are the universities that do the GramSat. So you can see that it is fewer universities, but at the same time, if you were going to choose your 4 choices out of these, then it may be worth doing the GramSat. And then I just put a slide about study abroad, but I'm aware that there's going to be a presentation on that. So I'll just go a bit about my experience. I think my experience is a bit unique, so I have tried to cover everything, but I know there's some things that are kind of specific to me. So as I said, put some questions if you have like some specific things you want to address and I can answer them. But my previous degree was in physiotherapy at Nottingham. I applied after my first degree, so I probably sent in my application 2 years after I was working as a physiotherapist. I did the UK CAT and I applied to a mixture of graduate and undergraduate entry, and I've gotten into the undergraduate entry medical course at Bristol, and I'm about to enter my 3rd year. So I just will go through a quick timeline, and this is just kind of to give you a rough estimate about how much time it takes to prepare for medicine. I think as a graduate, you probably have a bit more flexibility in the sense of, you know, I applied from working, so there wasn't really like necessarily a timeline in terms of, oh, I have to go next year. So if I kind of wanted to travel, or like people want to work and save up money, you just need to be aware that it probably takes about a good 1.5 years to prepare all the things that you need in place to be able to apply for medicine. So I kind of just had a time of like when I definitely decided, and it probably is the year before I applied that I started working on my personal statement and looking for work experience. The book that was mentioned, the like 1,000 UK CAT questions or whatever, I bought that as well. I also bought the PDF for the GramSat, and what I will just say about the GramSat personally, when I was going for the when I was deciding, there didn't seem to be as many resources for GramSat as there were for UK CAT, and that's why I decided to only do the UK CAT, because I just felt as though I may not be able to prepare well enough for the GramSat. But I think it's quite important, and this is why graduate entry is really specific to people. If you did a previous degree in like physics, or your previous degree encompassed chemistry, biology, or you like have a PhD, then you may find that actually the GramSat is going to be quite accessible for me to do. My previous degree wasn't very focused on biochemistry in that way, so that's why I felt like the UK CAT would be better for me. Around April, that's when I made that list, made sure that I knew exactly what the requirements of the university were, what UK CAT score that I would have to get, what GCSEs they wanted, what A levels they wanted, what they wanted in my degree. And it was around May time, June time, that I started really working on the UK CAT. So I did my UK CAT in September. So I gave myself about roughly like 3 months to really go in on revision. But as I say, some people do it in like 2 months, some people do it in a month. It really depends. I was working, so that's why I wanted to start everything quite early. But if you're kind of taking some time out, then you may not feel that you need all of that time. After I got the UK CAT, that's when I specifically made sure that like I picked the choices of university that I wanted to go to, and I finished my personal statement. So after I sent my personal statement, I actually didn't hear back from all of my universities until February. So it really depends on how the universities kind of work. Some universities do like interview in batches, so you may be in a later batch, because obviously you can give in your application, submit it via UCAS before the deadline, and then kind of February, April, that's when I had my interviews. April I got my offers, and that's when I decided what university I wanted to go to. In September, that's when I started. So things that helped me specifically was student room. As I said, I was applying from work, so I didn't really have like peers to compare information with or to ask about, okay, did you have interview from this place or were you called back? So I felt student room was very, very helpful. Again, obviously student room is people's opinion, so you do have to kind of take it with a pinch of salt. It's not like, you know, concrete information, but it did help me, especially seeing as like I didn't really have people to confer with, so it was just something to give me help. And I think, as a lot of people mentioned before, I don't have like medics or anything in my family, so that helps in that sense. Books off Amazon, you can kind of put in books for UK CAT, books for interview, books for personal statement, read the reviews, and I've just bought the ones that like had the best reviews. Medify was really good for UK CAT presentation preparation. When I did it, they only had they didn't have that much of a bank of questions, but I'm sure that bank is improved now, so you probably can you know, start it a bit earlier. I think I only did it for my last month because they didn't have that many bank questions. Medic Portal, similar to Student Room, is they get a lot of students to write for them. They get a lot of opinion pieces, so again, if you're not in like a school situation, it's quite helpful to understand, you know, what universities are getting back to people, what are they asking for people, how are people finding their interviews. And then I did like UK CAT school, UK CAT and interview practice courses, and I found those helpful because it just gave me people to practice with, really. So these are kind of tips for UK CAT and doing it. I'm by no means any expert in UK CAT. I just did it, so I think probably best to go to these websites to get like very good information on it. And like tips for personal statements, saying Medify is really good. That helps me with my personal statement, and the same with Medic Portal. So I'll just speak about the interview. And I think the main thing for interview, especially as a graduate, and that's regardless if you're applying to graduate entry medicine or applying as a graduate to an undergraduate entry medicine course, is it's really important to brag about what you have. Coming in as someone that's already done a degree is a really it's a big deal. Like, you've done a degree before, so you have a lot of transferable skills, so make sure you mention that. Make sure you mention that, you know what, I've been to uni before, I know my learning skill, or like, I've been to uni before, I know what it's like to have deadlines, or I know what it's like to manage my money. These things will give you, kind of set you out against the rest, and it also shows that like you have a maturity, and that's the kind of things that they'll look for in the interview. And same with the personal statement, is that, okay, you didn't go to study medicine when you were a teenager, you're coming now as like a more of an adult, what more have you gained? So again, your life skills, your life experiences, your focus, kind of clear decision making, so you're very confident that this is what you want to do because you did a degree before, you've experienced life in a certain sense, and you were like, actually, I want to focus on this. So make sure these are mentioned in your interview. And if you're kind of working, like for example, I was working, I brought in like my 9-to-5 work, like my job, like, oh, you know what, I helped implement this, I helped do this, and those things are quite important, so it's good to like mention those. And I just want to make a point of how to use your UK CAT score. So I think a lot of the deciding where to apply is gonna come from when you have a UK CAT, because as a graduate, you have your GCSEs, you have your A levels, you're kind of about to get your scoring for your university. So it is important that's kind of like the final piece of the puzzle, to give you a bit more information as to, you know, what is going to be like helpful for you or not, in terms of applying. So you want to make sure that you find out what the minimum scores are for the UK CAT, because it depends on how that university works, but some universities, they just have like a cut-off. So if they're saying that, okay, everyone must have like 700 average, they're just not going to look at your application any further if you don't have that. So it's really important to just not waste a choice. It's also important to note universities sometimes focus on particular sections. So for myself in Warwick, when I was applying, Warwick particularly focused on verbal reasoning, and it was if you had scored lowly in the verbal reasoning, then they wouldn't accept you to the course, and that's just something to be aware of. I think it's also important to look at the percentile, so see where your score falls in, because again, some universities specify the percentile Queen Mary's, I believe, when I was applying, specifies a percentile, so that's quite important to look at. And also, as I said, some universities use it as a screening tool, so make sure that you're kind of achieving like the minimum score that they want you to achieve. And just some things to remember, or like some tips that I had, is just that as I said, the grade requirements aren't necessarily lower, so it's really important to really take some time to look into these universities and make sure that you have the requirements that they want before you apply. Make sure you find out the weighing, because as I said, some universities look at verbal reasoning, for example, look at decision making, look at your situational judgment as to a deciding factor, as a screening factor as to whether they want to accept you. So make sure you look at that and evaluate that against what you have. They may expect more work experience. So some graduate courses expect you to have worked as a HCA or worked as like something in a hospital, as well as having the kind of minimum a week or a couple of days work experience. So that's just something to be aware of. And it's just to know that graduate entry medicine is very competitive, because a lot of times you're applying against people that are similar to you, but they aren't you. So it's really important to be yourself in your personal statement, be yourself in your interview, because no one has the same life. Everyone has different life experiences, so it's something to kind of be aware of. And the funding for the course is different. So I'll just go a bit into the funding, but as I say, like student finance is your best bet on finding out exactly how funding is going to work for you. But for the undergraduate course, you must pay for the course. Like they don't do student finance for the course, because it's almost like you're doing another undergraduate degree. But you can apply for the maximum student finance. And what some people do is they use the student finance, depending on what they get, because that's means tested, to pay for the actual course, but then also look at ways to support themselves living. That also comes into play in terms of distance that you're applying to university, if it's close to home. So that's just something to be aware of, because I wasn't aware of that before I applied. If you get into a graduate entry program, they pay for part of the course, but you have to pay for the rest. So they still don't pay for all of it. You do have to then again figure out how you're going to pay for the rest of it. And you can apply for student finance, but it's capped, so it doesn't cover it's not the same amount as you would get for like a regular undergraduate course. So it's just something to be aware of. So that's that, short and sweet, but just best of luck to everyone. As I said, I can't stay for the Q&A, so I don't know if anyone has any questions, because I know it wasn't that many people who are applying to graduate entry. Let me have a look.
And there's one question from Nice that says, do graduate entry courses offer widening participation opportunities?
I think that literally depends on the university. My university, unfortunately, a lot of the times they do exclude you if you have a degree before, if you're graduate entry, which it isn't fair, but unfortunately that's the way it is. So you do have to look at the university and look at what they offer, but it's not kind of there's not consensus for every uni. You do have to look at it.
Yeah, same. My university graduates are, like you said, we're excluded from most things. Yeah. Unfortunately, from all the good things, we're excluded. So
literally.
So yeah, we don't. At Barts, they don't. Yeah, they don't have that. So thank you very much.
No
one more question. In a personal statement for graduate entry medicine, would you include info relating to your degree in the same way as you would talk about your degree at interview?
Yes, anything that's relevant. That's one thing that I was going to say as well. In your personal statement, make sure you put things that are relevant. It's not necessarily like the most useful thing to say, like, oh, I was like captain of netball when I was in secondary school, which was like 6-7 years ago. Like, you do want to relate it to things that if you at university, talk about like the clubs you were at university. Like, I was working, I spoke about responsibilities that I was doing at work. Like, really make it current, because things from 7, 6, whatever years ago are just not, like, they're just not really that relevant. But I would say do bring in your degree, bring in like because that transferable skills of knowing how to write a paper, knowing how to commit to deadlines, knowing your revision style, those are really important things, and those are really helpful. So I would say put in your personal statement and say it in your interview. Like, even, do you know what I mean? You can never say it enough, because it's like a good thing. I think someone asked me privately about my email. I'm more than happy. I don't know if you're able to share my email. I can just put it in here.
Yeah. So if anyone wants any other advice, then they can email us and we'll share anything we can. And also just a point about the personal statement. I sat on the panel for BARTS this year, and the panelists don't actually look at your personal statement until literally 5 minutes before you come in. So there's no harm in mentioning things from your personal statement because they haven't had a chance to really review your personal statement anyway. So if it's relevant, then talk about it, basically.
Yeah, literally, I would agree.
Yeah. Thank you very much.
No problem at all.
Okay, last but not least is one of the most important things because a lot of people don't consider studying abroad. So we've got Colette who's going to talk about studying abroad, and then we'll have a Q&A. It might have to be a short Q&A because we're running over time by quite a little bit now. But yeah, I'm going to just...
Hello, hi.
Hey, I'm just going to make you host and then...
Okay.
And again, don't forget to please do the survey. It's really, really, really important for us. Thank you.
One second.
So yeah, if you have any questions you want to ask now while we just wait for Colette to come back, then I'm sure our lovely volunteers will be happy to answer any questions you have. And yeah, I hope you've been finding it useful so far. Thanks for bearing with us.
I know there were some questions from before that we could go through.
Yep.
With regards to how to get a publication, as a year 13, year 12, year 11 student, it honestly is not mandatory whatsoever. It is something that you have to be at a... Sorry, Daniela, you can say something.
If you know that, I'm an academic foundation trainee, and if you know that academia is something that is on the horizons for you or something that you enjoy, I would say think carefully about what medical school you go to. Because, for example, at my medical school, everyone had a publication because research was just happening just like that. So if you know academic medicine is something that you're interested in, think about going somewhere where you know the research is strong.
Mm-hmm.
So,
I thought they meant as in before they apply for medicine.
Before you apply for medicine, it's not key. If you want to do some research experience, like I said, go to the lab, do something there, but they're not going to expect you to have done a publication. It's just not feasible.
Yeah, before you apply, it's not essential. But if it's something you want to do in your uni, then I completely agree with what Daniela said.
Yeah, okay. Let me see what other questions there are from before. This one is, this might be a subjective question, but why Cambridge and not Oxford?
So I chose Cambridge because, well, firstly, I knew I wanted to do academia, and I knew that I wanted to go somewhere a bit more traditional. When I was applying my GCSEs, I had 7 A stars, and my UMSs were like 98%. This was back in the day when we had AS and A2. So I knew that Cambridge looked at your UMS, whereas Oxford were very heavy on what you got in your GCSEs.
Yeah.
So I would say, first of all, look at what they favor, and then see whichever one you meet the criteria for first. Because the most important thing is getting in. And from what I understand, like Oxford and Cambridge, some of my friends went to Oxford after the 3 years, and it's basically the same.
I visited both, and I would recommend you visiting both because you have the whole collegiate system, and you're not just applying to the uni, you're applying to a specific college. So visiting and finding out if it's somewhere you would actually see yourself, I would say, I think it's actually becoming more and more diverse, but compared to other cities, Cambridge and Oxford, they're not as good for diversity, so that's something you might have to factor in.
But our ACSs are, you'll find your community. Like
it is definitely improving. But for me, it was the same as Daniela in terms of my A levels were a lot stronger than my GCSEs. If you're someone who has straight A stars at GCSEs, Oxford might be good for you. I think they said Cambridge interview more people than Oxford do. So I also knew that if I could get to the interview table, I might improve my chances.
Mm.
So that was it for me.
Thank you. We're just going to go back to Colette. I think she's ready now. So yeah. You're on mute. Can't hear you. It's okay.
Okay, hi.
Hey.
So my name is Colette Bomboy. I'm a study abroad representative for ACMM, and today I'm going to take you through studying some information about studying abroad. Yeah, so hope you learned something from this. So a little bit about myself. I'm 19 years old. I go to university in Bulgaria, Medical University of Varna, and I just completed my first year, so I'm going to second year in September. Yes, and I'm also Kenyan. I've lived half of my life in the UK and half of my life in Kenya. So the ACMM Study Abroad Network was established in 2019 February, and the two lead advisors are Naomi and Nana. So Naomi is a fifth-year student, medical student in the Medical University of Pleven in Bulgaria, and Nana is a second-year dentistry student in Valencia University in Spain. Yes. So the main reason, the whole point of the Study Abroad Network is to show the reality of studying abroad and to encourage students to not only see studying abroad as an insurance. I feel like a lot of people don't really consider studying abroad as their first option, or they don't consider it at all. So when Naomi and Nana started looking for other students who are studying abroad, they just wanted to find people who are studying in different universities in different countries, so that we can all come together and share our experience with other potential students who want to study medicine and dentistry abroad. And it's a good way for us to show our experience truthfully, and for people to get a better idea of how it actually is. So I just have a quick question for everyone. Who exactly is considering studying abroad? Is there any?
If you're not, hopefully we can help you to think about it.
Hopefully, I can give you some information which makes you consider that. Yeah, but essentially the people who are part of the Study Abroad Network attend several universities. We have people who go to university in Bulgaria, Antigua, Cayman Islands, Spain, and Cyprus. So these countries, you may not have heard of some of them, but they have very reputable universities, and they offer a good education. So if you have any questions relating to a certain university, you can get in contact with Naomi or Nana, and they can link you to the rep for the university, and you can ask more questions. So for my experience at MUV, I can really only speak about myself. MUV, which is Medical University of Varna. The reason why I chose to study abroad was because I felt like I needed a new experience in life. I felt like I'd reached my peak in Kenya, and I wanted to branch out and just meet new people. And so I just decided to apply. So one of the good things about studying abroad is that the entry requirements are usually much lower compared to the UK. So for example, at MUV, you have to have between an A and a C, an A and a C in biology and chemistry. So that's quite doable, especially if you happen to get grades that you weren't expecting. Yeah, and also another thing, you don't have to do a personal statement. However, you have to do an entrance exam. And specifically at MUV, it has to be an entrance exam in biology and chemistry. And when you're preparing for these entrance exams, you can find resources on their websites, and you can also email the admissions office, and they can also help you. The syllabus for these exams aren't really much different from the A-level syllabus or the IB syllabus. So you don't have to go out of your way too much. There are a few things that you may have to find out, but everything is really, it's doable. And of course, if you haven't attained your qualifications in English, or if your native language isn't English, you have to do an English exam. Yeah. The next thing is, in Bulgaria, there are a lot of things that you can do. There are a lot of interesting things to do. And I feel like when I went to Bulgaria, I got the chance to do things I wouldn't necessarily have done. For example, we have the Rila Lakes, the 7 Rila Lakes, which you can go for hiking. There's also a popular skiing resort called Bansko, and everything is really cheap. So even if you could have done these things in the UK, it's cheaper, so you can have more fun and experience more things at a more affordable price. And the universities still have loads of societies, as you can see. So you can find a sense of community when you do go abroad, and you're not gonna feel like you're alone, because you're gonna find a group of people who with similar interests or who look like you or have gone through similar life experiences. So even if it is daunting to just start afresh in a new country, you'll always find a group of people where you can gravitate to. So a little bit about the course itself. In Bulgaria and most of the universities abroad, the medical degree isn't 5 years as it is in the UK. It's actually 6 years. However, it's the first 2 years consist of preclinical training. And the third, fourth, and fifth years consist of what is it called? Sorry, clinical training. Yeah, so, and then the last year is where it's your internship year, and it's comparable to the foundation year 1 in the UK, which I'm sure you're familiar with. So when you graduate after your 6th year, you get a master's, and when you go back to the UK, you can go straight into your foundation year 2. So you can see moving back to the UK isn't as difficult as you may think. It's a doable process, and you won't be set back in any way, even if there's an extra year. So personally, when I applied, I didn't use an agency, but looking back, I would have liked to, because it was a lot of stress. So there is loads of agencies, but one that I would particularly recommend is MedConnect Europe Agency. Some of my friends did use this agency, and they said that they really helped them because it's essentially run by students. It has students who have gone through this, and they truly understand the whole process. So they'll help you with moving to the country. They'll also help with the application process, the legal process, everything, pastoral care, accommodation, flights. So you'll never feel too overwhelmed, because they're going to be there for you. And if you're interested in studying abroad, you can just find them on Instagram. And when you do go to them, just mention that you came from ACMM, and they'll definitely help you with the entire process, and you won't have too much on your plate, essentially. And a few of the last things, the fees. The fees are also much cheaper compared to the UK. For example, at MUV, it's 8,000 euros a year, and it's payable in 2 semesters. However, I can say that the universities don't offer student finance, so you will have to know how exactly you're going to finance your studies abroad, but it still is quite affordable compared to other places. And then, of course, the living expenses are considerably cheaper compared to the UK. There are student accommodation, but I wouldn't exactly recommend that to people who are coming, just because I just wouldn't recommend it, essentially. And so you can find good accommodation for yourself, 1-bedroom apartments or 2-bedroom apartments, depending on whether you want to stay with your friends. And as you can see here, the prices and the exchange rate for the Bulgarian lev to pounds. Yes, and also the utilities, it's highly dependent on you, but it's still not too expensive. Yeah, so if I try to keep it short. If you have any more information, any questions, or you want to know something else, just don't hesitate to contact Naomi and Nana on the Instagram, or you can just email the email address which is here. And yeah, I hope you guys have learned something and more of you can consider studying abroad, because it definitely is a good option and it will broaden your life experience and you get to meet new people that you wouldn't necessarily meet. Yeah, that's it from me.
Thank you very much. That was really, really useful.
Thank you.
I did consider studying abroad, but I didn't know this as much as this at the time. So I think
that's one thing that many people don't have all the information.
Exactly.
So, yeah,
definitely. We have got a couple of questions. Since this is the end, there's one question that asks, is there a lot of racism / discrimination when studying in Bulgaria?
I feel like, okay, in my personal experience, I haven't faced any racism in terms of like outright covert racism where someone's calling N-word or something. But I have had experiences where people are looking at me a lot because they're like, whoa, there's a black person over there. Or I've also been asked to take pictures in a mall because, I mean, there's certain experiences, but it's not every day.
Yeah. Okay.
So, yeah, it's not that bad.
Okay. And then there's one more question about studying abroad. How did you find having to adjust to the local cuisine, culture, and learning the language?
Okay, so also about learning the language, it is compulsory to learn the language in your first and second year. However, after that, you don't have to. But the entire course is taught in English, so you don't have to worry about learning in another language.
Okay.
But in regards to coping with the food, I mean, the food is different, but you can still find food that you enjoy. Like, I don't particularly eat a lot of Bulgarian cuisine. I just cook what I enjoy, and this, like, you find whatever you want in supermarkets, really. It's, yeah. What was the last question? Sorry. The last part.
There's one about if there are any schemes for studying abroad in Asia. At the moment, I don't think we have any schemes for Asia, but if you just email the email you can see on your screen right now, and our study abroad advisors will talk to you about anything we have available and guide you through applying abroad if that's something you want to consider. So thank you everyone for your lovely informative presentations. We're just going to do a quick Q&A now. I think we'll do about 20 minutes, if that's okay. What we'll do is, if people can repost their questions, just because I know a lot of people have left and I don't want to waste our beautiful volunteers' time answering questions from people who have decided to go or have had to leave. So yeah, if you can just repost your questions. There's one question from Nice. On the personal statement, I have been through a lot of family tragedies that have reinforced my desire to become a doctor. Should I leave this out or mention it? I don't want to seem cliche. Has anyone got a preference to answer that question? You're on mute.
I think it's all about how you reflect on what those experiences have taught you. So if you don't get bogged down by the details, but you reflect on what they've taught you. For example, my best friend, she just graduated from Barts, and in her personal statement, she mentioned that her dad has epilepsy and how seeing him ill reinforced her desire to do medicine, or appreciated the more wide-reaching effects of ill health. So if you can reflect and make it more generalized, then I would say there's no harm in discussing some of your own personal experiences, because as one of the previous speakers said, it is your personal statement. And if that's shaped you, as long as it doesn't become this is my life story with no reflection.
Yeah, I agree with that. I think, like we said before, personal statements are not just about what you've experienced, but what that experience has taught you. So if you feel like those experiences have allowed you to gain some insight into why you want to be a doctor, or allowed you to gain some skills that have allowed you to understand what it would be like, those are the things you want to talk about. If it's just something that has happened that is horrible, but not necessarily has shaped the way you think about medicine, then it's probably best to just leave it out, but it's just up to you. Yeah, I think that's, yeah. Anyone want to add anything else on that, or no?
Just that you can definitely mention, but let there be other things as well, if that makes sense. Like,
Yeah, definitely, yeah.
so there's a balance. Don't let that be the center and the focus of your whole personal statement, because it will come across as a bit of a sub story.
Yeah.
But if you mention that and then add other things and other reasons why and other interests, then that will help soften the experience.
Yeah, exactly. And also, I think, sorry to go on about that, but I think you have to remember that when personal statements are being read, thousands of personal statements are being read. And so there are going to be a lot of people, unfortunately, that have had similar experiences to you. So it's more about your insight based on your experiences than it is about your actual experiences. So I think that's, yeah, it's really important to remember that. Okay, next question. We have a question. If you're applying in October, is it worth still trying to contact hospitals/GPs for work experience?
I would say because of the current pandemic, not really.
If COVID does settle down and we don't get a second wave, there's still a long time before your actual interview, or if interviews are going to be face-to-face. So if you do manage to get something after you've submitted it, but before the interview, that is still experience that you can reflect back on in your interview. So I wouldn't say it's wasted. If someone says actually come in the second week of October, then you don't have it in your personal statement, but you can still talk about it at interview. So if people are giving you opportunities, take it.
Yeah, exactly. You might as well make the most of it with this time that you have. If, like Daniela said, if there's a space to actually get some more experience, then go for it. Do it. I don't think there's any harm in doing that. And to be honest, you might even be able to get, you don't know, so it's worth asking always, because you don't know what you could get. You might even get something before you apply and you'll be like, oh wow, I didn't even think I'd be able to get something right now. So yeah, definitely worth asking. Another question, are there any setbacks for not doing maths as an A-level? Anyone? I haven't done A-levels for a while, so
I would say absolutely not. I did maths because I knew I would do well in it. You think you can get an A or an A star in, then forget it. I know people who did biology, chemistry, and physics. I know people who did biology, chemistry, and art, biology, chemistry, and DT, biology, chemistry, and history. Literally anything you can do well in, as long as you have the core science. Most unis ask for biology and chemistry. Then the third option is actually up to you. And sometimes universities like to see that you're not just the traditional biology, chemistry, maths student, and you can always bring in how studying, for example, I did a language at AS, and how studying German for me made me be able to think on my feet, to be able to understand and respond in a different language. So there's always ways where you can spin your third A-level choice and make it suited to studying medicine.
I will say it depends on what your course is. So we have preclinical and then clinical, and the preclinical, the physiology, the amount of maths and physics, like if you hadn't seen those sums before, it would have been quite a challenge. So also think about where you're going to go as well. But generally speaking, I agree. It doesn't really matter, but some courses are a bit more maths heavy than others. So just keep that in mind.
Manchester's not like that, by the way. We did not need maths whatsoever.
Nor is Barts. Yeah, I think, yeah. We're very lucky. Next question, which unis have good African Caribbean societies? I mean, Barts is good. We're good. We've got our own separate, we've got Queen Mary who have an ACS, and then we have one at Barts, which is our own individual ACS for just Barts. And yeah, I was ACS president a couple of years ago, and yeah, I feel like we're good. We're a small medical school in terms of the number of Black people, but we do support each other really well. We have a really good network. Like older years will always help you if you want any past papers or like you need anything. We will always help each other. We provide like you workshops, like teaching, and yeah. So bots is a good one. Obviously I don't know any other medical schools that well, so I wouldn't be able to say, but I'm sure you guys can talk about other medical schools.
I think, yes, you want to be somewhere where you're not the only minority. But when I went to Cambridge, there were 3 Black people in our cohort of what was initially 300. So it was so hard because I grew up in Wembley, so we had like no white people in our class, to go into an all white environment. It was very, very difficult. But it's important that you don't let that deter you, because wherever you go, you'll find your community. It might take a bit longer if there are a few Black people around, but you'll find your community. And it's sad to think that someone would say, actually, you know, a course is really suited to them, but I'm not going to do it because there are hardly any Black people there. So I think wherever you go, you'll find your people. And if the ACS is not good, then set it up. Go on the committee, create your own communities. It's about, we need to occupy space. We shouldn't be worried about us not being there initially. We need to go into these spaces and say, we're here, we deserve to be here, and now make room for us. So don't get too worried about being the only minority or the only Black person or the only, because you'll find your way.
Yeah.
I would say about Manchester, I believe we have the largest medical school in the country. I think we have over 400 students in our medical school. I would say we will always be the minority. Like, I think the whole of the UK, only 3% of us, only 3% of the UK is Black. But the more people you get in a space, the more Black people you'll find. So if you're okay with having a bigger cohort, then coming to Manchester would mean you're more likely to find other Black medics, because we just have more people. And we have an ACMS, which is an African Caribbean Medical Society. We also have an ACS, and there are lots of other Black people that don't do medicine that you can like find. All of my housemates are Black females who don't do medicine. So I think Manchester is actually very, very quite diverse as a city. Yeah.
I say in terms of Anglo-Ruskin, because it's literally, so I'm in the oldest year, so I'm going into my 3rd year. Again, in terms of our year group, there's only like 100 of us in each year group. So we're quite small. And especially, it also doesn't help that where the campus is, it's the med school's in the Chelmsford campus as opposed to Cambridge, where it's more diverse. So it's even more, like much smaller. So in terms of diversity on the actual course, for Black people, I know in my year there's about 10 of us. In the year below, it's even smaller, but there's a small community, but I wouldn't say it's as diverse as like other bigger medical schools. So that's the only thing that I'd bear in mind, but everyone's friendly.
And I think it's also important to note that, because this is something I didn't think about when I actually got into medicine, is I think when you grow up in London or in a city, you're very used to being around all Black people. And then you go to medical school and you say, what the heck? Where is everybody? And I think it's important to realize that that is going to be part of your life once you become a doctor, unfortunately, until it becomes, which is what ACMM is trying to do, until we have much more diversity. You are most likely going to be one of a few or the only Black person in the room a lot of the time. And you have to, like Daniela said, you have to realize that you still deserve to be there and you are paving the way for the next person. So know that even if you are the only Black person in that room, we're all supporting you, we're all going through the same things, and you'll get through, and then you can go home and just complain to your friends if you need to. But but that is part of being a Black person in medicine, unfortunately, at the moment. And I wish that someone had told me that before I started, that when I went into medical school, I was going to be one of the only Black people in the room a lot of the time. So yeah, I think it's important to remember that you might be used to going to sixth form, going to uni, or going to school and just seeing all Black people around you, or a very diverse group of people around you. But medical school is not usually like that. But you can still get through it, and you can still have a great time, and you can still make friends, and you can still enjoy yourself. So yeah.
Forums like these are great because you can see that even though you feel like a minority in your city or your medical school, there are loads of us across the country, and most of the time. We love reaching out and talking about our different experiences at different cities. And I've become quite good friends with Black people in other medical schools. So that's always an option as well. You're never, ever, ever alone.
Yeah, exactly. So yeah, there's another question. Do you guys have any tips for do you have any tips for anyone? Wow, I can't read. Do you have any tips or things to be aware of before entering sixth form?
I'll answer this one just because I think I'm one of the
yeah.
youngest people. Yeah. So with me, as I said earlier, I decided to change my school. So I went to Townley Grammar School and then I switched to St. Olave's. I'm from South East London. So those schools are both in Bexley. Well, Townley's in Bexley, Olave's is in Orpington. And what made me switch is I was looking for the best possible chance of getting into medicine. So what I was looking for were things like how many medics do they get in, what grades, like what percentage of them come out with A's and A stars, because the reality of it is, if you surround yourself with smart people, you will actually get smarter, I promise you. Because I went from Townley, where everyone was trying to get A's and A stars, to O-Labs, where people were now counting UMS, and 95 wasn't good enough. They wanted 98 and 100. I'm not saying that was a bit crazy. Like, even I understand that was crazy, but it also made me kind of step up a level. So instead of me being satisfied with now getting an A, I was now looking for 90 UMS and 95. And that's what enabled me to decide to apply for Cambridge, whereas before, that never would have crossed my mind. But going to a school where like Oxbridge is kind of like everyone's encouraged to be the best they can be, I think that's really helpful. Also, O-Labs had they did BMAT practice weekly, so they were established in helping people get into medicine. They did BMAT practice, UKCAT practice. There were specific tutors that reviewed all the medicine personal statements. Basically, that we had I think, a medical society that ran weekly presentations on different medical issues and current issues, and we did interview practice and stuff like that. So I think for me, making that transition was really useful. Things you need to consider is also, are you going to be okay with change? Townley was an all-girls school, O-Level was an all-boys school. For someone who doesn't deal with change very well, or they prefer to stay comfortable, where teachers know you, that might be something that might make you stay where you are. If you don't go to a state school, and you want to try a grammar, or if you do go to a state school and you want to try a grammar school, that might be a reason to change, because grammar schools just tend to be, they're grammar schools for a reason. But being at a state school doesn't mean you can't study medicine at all. And normally state school students have more access to widening participation initiatives. But those were my main considerations when choosing where to study at sixth form. And then obviously you also have to think about what subjects you want to study. But I think we've covered, biology, chemistry, and whatever third one you would like to do. But I hope that answers your question.
One of the key things when you're making the transition between year 11 and year 12 is that you need to get organized. You have to enter sixth form thinking, I'm doing this for myself and this is for my future. So I know a lot of people who, did really well at GCSE, but they thought, okay, this is different. This is the same. We can just leave everything to the last minute, not plan what we want to do in advance, not organize our work experience to the very last minute. So when you enter sixth form, the key is to think the next 2 years of my life are going to sort of lay the foundation for sort of what I'm going to do for the rest of it. So getting that mindset and get organized, that would be my top tip. Particularly now, because you guys don't even have AS levels. You have to you have to stay on top of things because everything is tested at the very end.
Oh,
thank you.
Oh, and it is a big jump, by the way. GCSEs and A level, there is a jump in terms of the complexity of the content. So don't be scared, because it is hard for everyone, but at the same time be prepared that it is a different ball game to GCSEs.
Yeah. Okay, next question. I guess it's a general, I'll answer it. Will the universities that consider GCSEs take into consideration how our grades will be calculated this year due to COVID-19? I think, unfortunately, with COVID-19, everything is very up in the air, and I don't think plans have been made as of yet for things like that. But I'm assuming they will. Everybody knows how big of an impact this has made to grades, ability to get work experience, like all things medicine related. So I wouldn't stress too much about that. I think they will probably have some leeway for GCSE grades in terms of applying, and even A-level grades, because you haven't been able to sit your exams. So, you know, that's not your fault. That's just life. So try not to worry about things like that. Just, I'd say, focus on going into A-levels, doing the best you can with your A-levels, getting your extracurricular stuff done, getting work experience, and you'll be fine. So don't worry about it too much. Another question. There's so many questions, but we only have a few minutes. This is a very deep, this can take a very long time. Okay, what's the most challenging obstacle you've had to overcome during uni and your current career? So if we limit that to just one, maybe like a minute answer each, on the most challenging obstacle you've had to overcome during uni and or your career.
I can start.
Sorry.
I think for me, it was the fact that I'm no longer the smartest person in the room. So I went from being top at my secondary school, top at my sixth form, to being amongst a room of incredibly intelligent people, incredibly intelligent. And at first, getting my first set of grades, I was like, oh my gosh, I'm not good enough. Not that I failed anything, but I was expecting to, you know, be ranking first all the time, and that just didn't happen anymore for me. And also just understanding that getting into medicine isn't the end, it's the beginning of a very long journey. And when I got into medicine, I kind of relaxed and I was like, okay, I made it, like that's it then. But then there's so much more to consider once you get in. So well done, you know, you've gotten in, but be ready to pull your socks up and work even harder, because it's the beginning of a very, very long process.
Yeah. I'll just say one thing as well is at medical school, just because you've got people on your course who are scoring better than you doesn't mean they're going to be better doctors than you. So just remember that grades are not everything. It's about how you interact with your patients. It's about, you know, your compassion, all of those things. So try not to feel less than if you're not scoring as well as other people on your course. But yeah. The question is, what is the most challenging obstacle you've had to overcome during uni and your current career? That's a very difficult question. I haven't got time to talk about my journey into medicine, but I was successful after my third attempt of applying to medicine. So that's probably my most challenging obstacle. And also, similar to Anna, I was always used to excelling in my academic life, and I had a harsh reality check once I started medical school, but it gets better. I know I'm going to be a good doctor regardless of where I rank anyway. So yeah, I think probably those things would be my most challenging obstacles. Yeah, next person.
I think for me, like the others said, in terms of like the academic aspects, but I think also highlighting, okay, so my first uni experience, I went to Leicester, and again, because I'm from London, we have a lot of Black people. So, and then I went to Leicester, there was a lot of Black people. Then my uni is now in Essex. For me, there's not that many Black people. Again, that was a shock. It still is a shock to me, and I'm still processing it. But I think also what I realized, and I also encourage everyone, like when you do get into medicine, don't just have friends that are medics. You need to have friends that aren't, because when everyone's like getting crazy and with the stresses of medicine, you need to like talk to sane people. I say that in the nicest way only because you have to remember, don't let medicine be be everything that there is. There's life outside of medicine. So yeah, so I'd encourage, and because like a lot of my friends, they don't do medicine. Like there's only like a few of us who actually do medicine. So and I like talking to them, and it gives me just a sense of normality, and that things are actually going to be okay. But yeah.
Daniela?
So I, during finals, I found out I was pregnant with my daughter. So, so I had to do.
I think you trumped the most challenging. Yeah.
And it was a lot. But at the end of the day, I got distinction overall. And I think it just taught me the lesson that you can't take your life experiences, and your journey is your own journey. you can't use what other people and other people's capabilities as a template for how you should navigate through life. And I think that is just, it's just important to know your story is your own. Your story will be different from the person next to you. And that's not, there's no shame or there's nothing wrong with doing things differently. So I would say, yeah, that was like the biggest challenge for me. She's cute.
That's amazing. Yeah, that is definitely a challenge.
And I went back to
a good
after
one.
5 weeks. So
Wow.
because
That's a huge other story that we probably don't have time to talk about. But inspirational people in medicine, and it shows you that, like Daniela said, everyone's journey is different, and just because your journey doesn't look like anyone else's doesn't mean you're not going to be successful. So remember that. Colette, are you there? I don't know if you're there or not. No. Yeah.
Sorry,
If you
I was being called. Yeah, sorry.
No worries. Just if you want to tell us your biggest challenge so far at university.
I feel like for me, when I first went to Bulgaria, it was just I was the only Black person in the room as well, and just it was kind of a shock, especially doing IB in Kenya and then being in such a diverse environment, and then coming to Bulgaria and being the only Black person. It was just, I felt out of place. So I started having like a lot of kind of identity issues, and also just feeling like I need to work really hard and just prove myself. So I ended up putting a lot of pressure on myself when it came to my grades. And yeah, so that's, for me, that was my biggest challenge. But I figured out how to maintain my grades and also just like my life, and realize that I need to find a balance. Yeah.
Definitely. I think being Black in medical school is a challenge in itself. And unfortunately, we don't have much time to talk about it. But just remember that we are literally all rooting for you. Every single one of us is rooting for you. We're all a community, even if we're not together. We are rooting for each other to be doctors, because we are the change. We are the change that we want to see, as cliche as that sounds. But I think we're going to have to stop the questions there, unfortunately. If you have any burning questions, feel free to email us and we will pass on. If you have a question for anyone specific, we're happy to pass those on for you. If you have a question about applying, a question about anything else, just send us an email. 1 second, I'm just going to...
Really quickly, I want to echo what Oke said about medicine not being your whole life and finding areas where you can escape medicine. I know someone asked the question about being prepared mentally, and I think that's something that sometimes in the Black community we don't talk about, that medicine can really, really get to you. And I do think universities do offer services if you want to reach out. I'm sure all medical schools have a pastoral support team. I know my university has free counselling, but it's kind of like, if you're not going to take the first step and reach out, no one's going to come to you. So being okay with not being okay, having escape route of medicine, 110%. I have never lived with medics. That was my one rule. If you study medicine, I will not live with you, because I don't want to come home to more medicine. And it's okay to have medicine and be your own person. Like, I don't like defining myself as a medical student, because it is not the entirety of who I am. Although it takes up a lot of my time, I'm so much more than what I study. So just bear that in mind. Your mental health is very important. Look after it and reach out to people, because you are not alone. We've all cried throughout this degree. Reach out to older people. We're honestly all here for you, as has been said already.
Yeah, that's a very great ending, definitely. Just quickly, very quickly, just to let you know some of the initiatives that ACMM has coming up. We have a personal statement reviewing service, which is going to start at the end of August. Keep up with our Instagram and our Twitter, which are at AC Medical Mentor for Twitter and at AC Medical Mentors for Instagram. if you want to find out about the things we're doing. We're also going to be starting a series of ebooks to support you with your application and all the different aspects of your application. And we're also going to be doing interview coaching for free at probably around November. That will start, and we'll hopefully have our interview workshop as well in November if COVID permits. So yeah, I hope everyone has enjoyed this. If you haven't filled out the survey, please fill out the survey. It's so important for us in order for us to make sure that we're actually providing things that work for you, that help you. We can improve if anything isn't that useful for you, or if you feel like, oh no, I don't think you covered this and I would have liked this. We really need to know how you feel about what we're doing. So please fill that survey out. And thank you for attending this webinar. Thank you so much to our lovely volunteers who have taken time out of their day, time out of their weeks to make presentations and to sit here on a Saturday telling you all about how to apply to medicine. These are the people that make ACMM what it is, and these are the people that are going to change the future for Black future doctors and dentists. So thank you guys so much for your support. Yes, so if you guys who are watching, just use your phone to scan the QR code, or I've left the link in the chat, so if you can scroll through the chat, and if you have any questions, send us an email. But this is the end of our conference, our medical application conference. I hope everyone has a good weekend, and I hope it's been useful. But yeah, thank you. Bye everyone.